Hello, I'm Dr. Vanita Rattan, a medically qualified doctor and a cosmetic formulator specifically for skin of color. Today's video is such an important one. It is about dry skin. Now, dry skin is more than just flakiness, especially for skin of color. We're talking about ashy skin, hyperpigmentation risks, tightness, and even long-term barrier damage if you don't treat it right. But what's worse is all the misinformation out there. Today, we are busting myths, spilling secrets, and diving deep into science-backed solutions. So what really causes dry skin? There are both internal and external causes. To check internally you are hydrated, look at your urine color. Urine should be a pale yellow. If it's looking like a darker yellow, it means that you yourself are dehydrated. And guess what? The least important organ of your whole body is your skin. Every organ is more important than your skin. Your kidneys, your heart, your lungs will all be hydrated first. And so if you are feeling tight and dry and your urine is very dark, it may well be an internal issue and you're not drinking enough water. So a little trick I do is first thing in the morning, you can see we're right at the bottom now, but first thing in the morning, I will fill the water up to here and I will literally put in 1 sachet of the collagen boost. So I know I'm getting my 8 grams of marine collagen and I'm getting my 1.5 liters of water. And so even if I have a couple more glasses on top of that throughout the day, I'm going to be good. But it's a good way to just make sure you have enough. Often you're thirsty and you reach for food when actually you want water. And if you have that bottle there, it's just easy to grab and it tends to be what your body needs more of anyway. So number 1 is ensure you have a water bottle. Number 2, you're checking your urine color. Now looking at the external environment. Winter dries your face and body out. Skin of color naturally have fewer ceramides compared to Caucasian skin. Ceramides are the fatty glue that holds your skin cells together. Without enough, you lose moisture faster, and that's why ashy skin can creep up so quickly on your face and your body. So the myth is thicker moisturizers work better. The truth is, actually, this is not always the case. Thicker moisturizer doesn't mean more effective. Look for humectants like glycerin. They pull water into the skin. Occlusives like petroleum jelly lock water in, but only after your skin is properly hydrated first. So how can you tell if your dry skin needs serious attention? Here's what to look for. Sign number 1, ashy skin. It's not just dryness, it's your skin's way of screaming for exfoliation and hydration. When you moisturize the skin, have you noticed the skin goes from looking ashy to looking like it's glowing? Because micro exfoliation is taking place. And this is the way to exfoliate dry skin. You don't go in with a chemical exfoliator, it's too harsh. Your skin barrier is already sensitive. So you moisturize in order to exfoliate dry skin. Sign number 2 is flaking. The skin of color, flaking often leads to hyperpigmentation because inflammation can trigger your melanocytes, the cells producing the pigment melanin. Sign number 3 is tightness. This happens when your lipid barrier is compromised, allowing water to escape. This also leads to your skin looking duller because water is what separates the skin cells and allows light to reflect evenly. Now, untreated dry skin can actually lead to chronic inflammation. A 2021 study linked persistent barrier damage to conditions like eczema and PIH, post-inflammatory hyperpigmentation. This is why you want to treat it before it sort of spirals into an area which then starts to become eczema. Moving on to common myths and mistakes. Myth, you need to exfoliate every day to fix dryness. No, over-exfoliating strips away your skin barrier, especially for skin of color, making it harder to retain moisture. So use fatty moisturizers, i.e. micro-exfoliate the skin. The next myth is all oils are great for dry skin. No, unfortunately, this is not right. Essential oils like tea tree oils or eucalyptus can actually dry the skin out further. So stick to barrier repairing oils like squalane, jojoba, or argan oil. The next important thing to know is, did you know that harsh cleansers are one of the biggest culprits for dry skin? Cleansers with harsh surfactants, so that's like the soap inside the cleanser, can strip the natural oils. A study in the Journal of Dermatological Science found that switching to a low pH sulfate-free cleanser improved hydration by 45% within 2 weeks. The next mistake is layering products in the wrong order. So what you want to do is go cleanser, toner, serum, moisturizer, SPF. Mixing this up can reduce the effectiveness of your products. So what's the perfect routine for skin of color? What are the actives you need? Number one, you want ceramides. These are lipids that naturally occur in your skin and help to retain moisture by sealing the skin cells together. They're essential for repairing the skin barrier and preventing moisture loss. The second ingredient is niacinamide. It's going to be your best friend. This ingredient helps to improve the skin barrier function. It reduces redness and it soothes irritation. It also helps to regulate oil production, making it beneficial for dry skin that may also be sensitive. The third ingredient that you need to have in your moisturizer at least is glycerin. It's a beautiful humectant and causes no irritation to the skin. It draws moisture from the environment into the skin itself. One thing I would tell you is to have a humidifier next to your bed so that you know that water is being drawn from the environment into the skin. If you're in a dry environment, what can happen is water from the lower levels can be drawn to the upper levels where the glycerin is, and actually you're drying the lower levels, which we absolutely do not want. So if you know you live in a desert or you live in a dry area, have a humidifier next to your bed. Next is an oldie but a goodie, shea butter. This is a rich emollient that provides deep hydration, helps to soothe and protect the skin. A study from 2021 found that urea-based products improve skin hydration by up to 80% after just 4 weeks. You would also want licorice root extract for hyperpigmentation. You want panthenol to be anti-inflammatory. You also want vitamin E, a powerful antioxidant that helps to mop up damaging free radicals. And you want peptides to help stimulate collagen production and improve skin elasticity, making the skin firmer and more resilient. The morning routine starts off with your gentle cleanser. 5% glycerin, 2% niacinamide, 3% Centella asiatica, which is it's your green tea extract. So it's anti-inflammatory, but it's also anti-hyperpigmentation. And this is what we added basically to your micellar gel wash. Plus I added Derm Stim. These are stem cells that are anti-aging and anti-hyperpigmentation. And the most important thing about this is the surfactant is gentle. So your skin is going to feel hydrated after you've washed it. That is absolutely key. It should never feel tight or dry. Moving on to the hydrating toner. So this is niacinamide at 3%. This will help to minimize pores, fine lines, and pigmentation. Plus I put 6% glycerin in. This is going to hold water in the top layer of skin, plus 2% urea, because that's proven to help with dry skin. Plus panthenol at 2% and Centella asiatica, and of course your anti-inflammatory allantoin. Moving on to the moisturizer. So a 2020 meta-analysis of over 200 studies confirmed that ceramide-based moisturizer are the gold standard for repairing dry skin. In addition, I put in peptides to help with skin hydration, skin texture, and strengthen the skin barrier. Put in 2% niacinamide. I've put in 4% glycerin. Plus I put in emollients like shea butter, and of course algae extract, which helps to improve UV damage, antioxidant, and it's hydrating. And of course licorice root extract for brightening the skin. Moving on to your SPF 50. You have to wear SPF 50 even if you're indoors. And I prefer mineral over chemical because number one, it doesn't enter the bloodstream, and number two, it's anti-inflammatory. Did you know skipping SPF 50 can actually make dry skin worse? UV rays weaken the barrier over time, even if you don't see immediate damage. So let me show you what this looks like. I formulated this for skin of color, so there's no white cast. So I'll just put a little bit on the hand, basically blend in really easily and quickly. It gives you a nice dewy finish. So I'm wearing it right now under my makeup. In here, there's of course niacinamide as well and stem cells, plus it's anti-inflammatory. So your nighttime routine is the double cleanse. So you want to go in first with your oil cleanser, and then you go in with your micellar gel wash, especially if you're wearing SPF during the day. Then you went to wear your moisturizer, so your nice fatty moisturizer, and then you do your slugging and you use your humidifier at nighttime. So it's a really easy nighttime routine. Now you know how to treat dry skin. Watch what mistakes not to make.